All right, myxedema coma. So we're going to go over myxedema here. This is an endocrine emergency. So what it basically is they don't have enough thyroid hormones. So their metabolism goes way down. So they also have slower muscular contraction because of the neuromuscular reactions being slowed down. They can't move quite as fast. So there is an accumulation of something called mucopolysaccharides in the skin, and we'll kind of see a picture of that. It's a sort of swelling, but it's not like a third spacing that we've been going over with fluid. It's actually tissue. So it does feel kind of jelly-like, almost cement toward the end. So these things are responsible for how you actually repair wounds. So it turns into almost like scar tissue, and it gets really dry. However, when it gets wet, it does get softer. As far as the classic findings, puffy skin, particularly around the face, slower reflexes, something called thick speech. It's real slow. They can't think very quickly. This is going to be those skin signs here. So it's actually different sorts of skin. So they are swollen because you can see where they were their socks. But it's not fluid, it's actual tissue. So this is the sort of classic picture of hypothyroidism, which myxedema is. It's kind of long term. They get really cold. They can't maintain their body heat. Everything becomes brittle. Constipation, everything slows down. Dry skin, intolerance to cold. They can lose hair because it becomes brittle. So as far as the late findings, though, these are the ones that are more important for us. Look for these in anybody that has a history of thyroid problems. So things like slow heart rate, decreased LOC, and they're going to have cardiac complications, particularly bradycardia. So as far as the cause, it's caused by primary hypothyroidism, which means there's a problem with the actual thyroid gland. Secondary cause, secondary hypothyroidism is going to be caused in the brain in places like the pituitary not releasing enough thyroid stimulating hormone and that sort of thing. 60 to 70% of the cases is caused by something called Hashimoto thyroiditis. What this usually means is it gets really inflamed in the thyroid, and then initially they're going to be hyperthyroid, but then once more of the inflamed tissue is destroyed, they're going to become hypothyroid. So they can actually have this caused by a radioiodine treatment for Graves' disease. So this is going to be the other 20 to 30% of cases, but most of them, like I said, is a fairly common disease called Hashimoto thyroiditis. So myxedema coma is the one that we're more concerned about. So this is a life threat. It's a decompensated hypothyroidism. It can be caused by a number of things, but some sort of exacerbation caused by trauma or infection, even cold exposure or heart attacks. Basically, whatever stresses the body. Normally, it does occur during the winter months in elderly women that are undiagnosed for hypothyroidism, but still the history is important. It's going to be mostly women because women are the ones that typically have thyroid problems. So the classic presentation here are going to be these sort of top symptoms. Altered mental status, along with hypothermia. If they haven't been outside, I would go ahead and start thinking about this. But there are things that are non-diagnostic about it, such as low blood pressure and slow heart rate. They will typically be hypoglycemic, a little bit at least. And then they're going to have some shallow breathing, which means that your end tidal is going to be high, along with low oxygen. So they're going to have a non-pitting edema, like we talked about before, from that tissue. A lot of times that's going to be yellow in color. And that's because it actually is deposits of keratin as well in there. Their skin's going to be cool because they don't have very good blood flow, and dryness again because this affects actual sebum production, which is going to be your old glands. So the speech is going to be slow, slow rate, slow rhythm, deep, low pitched. No, it's similar to what you would sound like if you had a cold. So certain findings actually increase probability of hypothyroidism. So that speech that we talked about, as long as a cool, dry skin, bradycardia, and then that coarse skin. So some of the things that are a little less compelling here is going to be hair loss. Check around the eyebrows. That's a good place. And then places on the body that are actually just isolated cold spaces. So this is a clinical diagnosis, so we're not going to make it because they actually had to test the TSH and all this other stuff. Basic reason for that is because it could be either primary or secondary hypothyroidism, which we talked about. So you actually have to have the blood work to know what the problem is. But as far as your other differential stuff, think about sepsis and your SIRS criteria. SIRS criteria and systemic inflammatory response syndrome. We've talked about this already. But it's going to be a pulse rate above 90, respirations above 20, a white blood cell count either above 12 or below 4, and then a temperature above 38 or below 36. That's in Celsius. So that'll be 100.4 Fahrenheit on the high end, something above there, an actual fever. Or it's going to be 96.8 or below. And then of those 4, you just need to hit 2 of those. Another one is going to be Addison's disease because that also expresses cells in skin problems. They're going to have slurred speech, though, in Addison's, along with the hypotension. President Kennedy had Addison's disease, by the way. They're also going to be febrile. So as far as myxedema coma, they're going to be cold, right? And you got to look for hypoglycemia, your CHF, your strokes. They've been outside hypothermia, and then certain drug overdoses, especially opiates. So the treatment's actually just supportive. So they're going to try to replace their thyroid hormone, basically. But as far as we're concerned, just make sure you get your ABCs and treat those. Technically, if there's a paramedic there, they can use vasopressors, but they might not work. So you might want to restrict them on water because they actually have low salt, which is going to get them some cardiac dysrhythmias. So you don't want active warming on these people. You want passive, which just means pile them up with blankets there. Don't use hot packs. So you want to treat the precipitating causes. It's those stressors that actually cause the event. So you can correct low blood sugar. You can give them steroids because of the increased metabolic stress. The actual adrenal glands aren't functioning well. So it's important that you actually use hydrocortisone, which is going to be naturally occurring in the body. So there are some other things that can actually make these things worse here with myxedema coma. The hypoxia, the low salt content, the high CO2 because of the shallow breathing, and whatever other stressor that there is. And like I said, they're going to give them thyroid hormone replacement. They're going to monitor these people.